So good evening to all. So today we discuss regarding the anti-hypertensive drug that comes under the pharmacology. Clear? The anti-hypertensive drug. The anti-hypertensive drug to treat the hypertension. That is the anti-hypertensive drug. First, the first line anti-hypertensive drug. The first line anti-hypertensive drug is the CCB, means the calcium channel blocker. Second one is the S inhibitor. Clear? First line is the calcium channel blocker, S inhibitor, and the thiazide diuretics. Clear? Thiazide diuretics. Clear? The first line antihypertensive, like the CCB, the calcium channel blocker. The example is the nifedipine. Clear? The S inhibitor, that is the angiotensin converting enzyme inhibitor, that is the enalapril. That is the thiazide diuretics. Clear? That is the first line anti-hypertensive drug. Then the second line anti-hypertensive drug. Then the second line anti-hypertensive drug is the alpha blocker. Second one is the beta blocker. Clear? Alpha blocker, beta blocker, then the alpha 2 agonist, the alpha 2 agonist, then the direct renin inhibitor, and the direct renin inhibitor. Then fifth one is the spironolactone. These are the second line anti-hypertensive drug. The second line anti-hypertensive drug is the beta blocker, alpha blocker, beta blocker, alpha 2 agonist, direct renin inhibitor, and the spironolactone. That comes under the second line anti-hypertensive drug. Then the hypertensive urgency. Hypertensive urgency. Okay? Hypertensive urgency means if the BP rises very high, that is the hypertensive urgency. In the hypertensive urgency, the first drug of choice is the clonidine. In the hypertensive urgency, the first drug of choice is the clonidine. Then the S inhibitor, then ARBs. Clonidine S inhibitor means the enalapril, ARBs means the some certain, telmisartan, That is the ARBs. Yeah. Then, if the patient has hypertension and osteoporosis, the patient have hypertensive and osteoporosis, then the drug of choice is the thiazides. Yeah. If the patient have the hypertensive, simultaneously they have osteoporosis, then the drug of choice is the thiazides. Your patient have hypertensive and osteoporosis, the drug of choice is thiazide diuretics. Yeah. Then if the patient has hypertensive with BPH, patient have hypertensive plus BPH. Clear? The patient have hypertensive means the high BP, BPH means benign prostatic hypertrophy. The drug of choice is the alpha blocker. Alpha blocker, that is the miscellaneous. Clear? So remember this. This is the question in the entrance exam. That is the very important question. If the patient have hypertensive with BPH, is the benign prostatic hypertrophy, the drug of choice is the alpha blocker. The drug of choice is the alpha blocker. Then remember one point, the important point. Anti-hypertensive drug, anti-hypertensive drug that contraindicated in pregnancy. That is the ACE inhibitor. Clear? That is the very important question. The anti-hypertensive drug that contraindicated in pregnancy, that is the ACE inhibitor group of drug. The ACE inhibitor group of hypertensive drug that contraindicated in pregnancy. The drug that causes the congenital malformation of fetus. So that the ACE inhibitors like drug, that is the enarapil, that is contraindicated in pregnancy. So write down this. So that is the anti-hypertensive drug, the small topic. So next class we'll discuss about the next pharmacological topic. So thank you to all.